Good afternoon. I want to thank everybody for giving us an opportunity to speak on this topic. I'm kind of concerned that we're still in a state of emergency, but that the emergency is being labeled as more COVID cases when the testing has been proved infallible or fallacious. That what are we testing against if the virus hasn't been isolated? So that's concerning to me that we're having an emergency based on tests and test results for faulty tests. The other thing that's concerning to me is there's still the issue that propaganda is legal in the United States, and that there's an argument between misinformation, malinformation, and propaganda, but nobody will admit that propaganda is legal in the United States. There's also the issue of people like Bill Gates participating in global pandemic mock-ups. For instance, he's just recently participated in one, and that we can expect another pandemic in 2025. There's an article at LifeSite News, and it details the information at Johns Hopkins University where they held this alleged fictitious pandemic training exercise in October. The name of the training is called Catastrophic Contagion. In the video released by the organizers, a fictional news segment alerts virus called Severe Epidemic Enterovirus Respiratory Syndrome 2025, or SERS 2025. The fictional news anchor went on to say that the virus could cause a severe pandemic if early containment and mitigation efforts aren't successful. I'm happy to forward this article to you. I also discovered that the U.S. Right to Know, the agency that was responsible for helping us get labeled GMO onto the ballot, I think that was Prop 37, has done a wonderful article that's been published just recently, December 12th, and it's the timeline of the coronavirus pandemic. And it shows internal documents with Fauci and others that before 2017, they knew that they were going to release this on the general population. So all of us here have a responsibility to all of our family members and all of our friends to get to the bottom of the truth, because truth is important to our mental health. And if we have caucuses in the community and we're talking about discrimination and alienation and inclusion, then maybe we need a mental health caucus in this community as well, so that we can address these kinds of issues openly, and that we can talk about the malinformation coming from the federal government and how they are bullying people at this level and making them comply when maybe they don't want to. Maybe they're holding money over their head. Maybe they're telling them they're not going to give us the money that we need for our roads if we don't comply. But we owe it to our community to stand up to this nonsense. Thank you.
Thank you, Christine.